Hello everyone, and welcome to our channel. As one of the world's most commonly used over-the-counter medicines, Tylenol has long been the first choice for many people dealing with fever, headaches, and cold symptoms. It also has a more professional name, acetaminophen, known in many countries as paracetamol. What most people do not realize, however, is that behind this seemingly simple white tablet lies a medical legend spanning more than 140 years. Today, let us explore the little-known story behind Tylenol. The history of acetaminophen dates back to the 19th century. As early as 1878, Harmon Northrop Morse, a researcher at Johns Hopkins University, first synthesized the compound through a chemical process. Using tin to reduce p-nitrophenol in glacial acetic acid, he successfully created acetaminophen. But at that time, no one recognized its medical value. The discovery was almost buried in history. Everything changed in 1884 because of an accident. Researchers were attempting to develop a new treatment for parasitic diseases when they unexpectedly discovered that a structurally related compound, acetanilide, had fever-reducing properties. This accidental finding sparked scientific interest in an entire class of aniline derivatives, including acetaminophen. In 1893, German physician Joseph von Mering first introduced acetaminophen into clinical use. Yet it failed to gain popularity at the time. The reason was simple: it lost the competition to another drug, acetanilide. Because acetanilide had a simpler structure and was easier to manufacture, it quickly dominated the market under the brand name antifebrin. Later, doctors discovered that it could relieve pain as well as reduce fever, and for a time it became widely popular around the world. But problems soon emerged. Physicians gradually realized that acetanilide carried significant toxicity, especially a tendency to cause methemoglobinemia, a disorder that reduces the blood's ability to carry oxygen. Patients' skin and lips could turn bluish-purple, a condition medically known as cyanosis. Scientists therefore began searching for safer alternatives. Among many candidate molecules, two stood out: phenacetin and N-acetylparaminophenol, what we now know as acetaminophen. Surprisingly, von Mering ultimately abandoned acetaminophen and chose phenacetin instead because he believed it was safer. History later proved that judgment to be wrong. In 1899, Bayer successfully launched aspirin, rapidly capturing the pain relief market. Although phenacetin lost much of its spotlight, it continued to be widely used for decades afterward, especially in combination pain medications where it became nearly ubiquitous. By the 1930s, over-the-counter, headache powders had become popular throughout Europe and the United States. These products often contained phenacetin or aspirin combined with caffeine, and sometimes even barbiturates. Many people took them in large doses over long periods of time, sometimes for years. As a result, severe cases of chronic poisoning began to appear. Patients developed anemia and methemoglobinemia, but even more alarming was irreversible kidney damage. The condition eventually became known as analgesic nephropathy, or phenacetin kidney disease. Due to these serious side effects, the U.S. Food and Drug Administration officially removed phenacetin from the market in 1983, bringing its history to an end. Meanwhile, the once overlooked acetaminophen experienced a dramatic reversal of fortune after nearly half a century in obscurity. In the late 1940s, American scientists revisited the metabolism of phenacetin. Researchers Lester and Greenberg at Yale University, together with Bernard Brodie and Julius Axelrod from the New York City Department of Health, made a crucial discovery. They demonstrated that both phenacetin and acetanilide were metabolized in the body into the same active pain-relieving substance, acetaminophen. The toxic effects, on the other hand, came primarily from another metabolite known as phenylhydroxylamine. This discovery was groundbreaking. It meant that doctors could potentially administer acetaminophen directly, preserving the therapeutic effects while avoiding much of the toxicity. In 1955, McNeil Laboratories, now part of Johnson & Johnson, introduced the first acetaminophen syrup for children under the brand name Tylenol. It was marketed as an alternative to aspirin, one that was safer for children and gentler on the stomach. The name, Tylenol, itself was cleverly created from parts of the chemical name N-acetylparaminophenol. T came from acetyl, while the was derived from phenol, combining to form the now world-famous brand name Tylenol. In 1959, the adult version of Tylenol was introduced, and by 1960 it officially became an over-the-counter medication available without prescription in the United States. As time went on, people gradually realized that aspirin could cause gastrointestinal bleeding. Later, newer non-steroidal anti-inflammatory drugs, or NSAIDs, such as ibuprofen, were also found to carry risks involving the kidneys and cardiovascular system. Compared with these drugs, acetaminophen's advantages became increasingly clear. At recommended doses, acetaminophen is primarily metabolized in the liver. Most of it undergoes glucuronidation and sulfation, producing non-toxic, water-soluble metabolites that are later excreted by the kidneys. Overall, the process is relatively safe. Unlike earlier aniline-derived drugs, it does not readily cause methemoglobinemia, and unlike NSAIDs, it is much less likely to irritate the gastrointestinal tract. Gradually, it became a trusted option for both doctors and patients. Of course, this does not mean it is risk-free. In cases of overdose, acetaminophen produces a toxic metabolite capable of causing severe and even fatal liver injury. In fact, acetaminophen overdose remains one of the most common causes of drug poisoning worldwide. By the 1980s, Tylenol officially surpassed aspirin to become the world's best-selling fever and pain medication. The World Health Organization also added it to its essential medicines list. In many countries, it became the recommended first-line medication for fever and pain during pregnancy. But perhaps the most surprising fact is this: even after more than half a century of use, scientists still do not completely understand exactly how acetaminophen works. Yes, that is correct. More than 140 years after its discovery, researchers are still studying its true mechanism. Traditional painkillers such as aspirin, ibuprofen, and diclofenac belong to the NSAID family. They mainly work by inhibiting enzymes called cyclooxygenases, or COX enzymes, thereby reducing the production of prostaglandins that trigger pain and inflammation. This is why they are often highly effective for inflammatory pain such as toothaches, arthritis, or muscle injuries. Acetaminophen, however, is entirely different. It has almost no significant anti-inflammatory effect. It cannot effectively reduce swelling or redness, yet it still relieves pain and fever remarkably well. This suggests that it operates through a completely different pathway. Later studies showed that acetaminophen can cross the blood-brain barrier and enter the central nervous system. There, it may act on the hypothalamus and influence the body's endocannabinoid system. Endocannabinoids are signaling molecules naturally produced by the body that regulate neural communication, generate feelings of comfort, and reduce pain perception. This may explain why Tylenol can modulate pain at the level of the brain itself. But the story does not end there. In 2025, pain pharmacologist Avi Priel and his team at Hebrew University of Jerusalem proposed another important discovery. They found that acetaminophen may not only work in the brain but could also directly affect peripheral pain neurons throughout the body. In laboratory experiments, the researchers observed that acetaminophen could block sodium ion channels on nerve cells, much like a local anesthetic. In simple terms, it may cut the electrical wires that transmit pain signals. The pain message may be intercepted before it even reaches the brain. This discovery filled in another crucial piece of the puzzle behind Tylenol's pain-relieving effects. Yet one mystery still remains unresolved. How exactly does it reduce fever? Because of this, scientists suspect that its pain-relieving and fever-reducing effects may involve entirely different biological systems working together. Increasingly, researchers now believe that acetaminophen may represent a classic multi-target drug. For scientists, uncovering Tylenol's secrets may also provide critical inspiration for the next generation of pain medications, drugs that are more precise, more effective, and associated with fewer side effects. That is all for today. If you enjoyed our program, please do not forget to like, subscribe, and turn on the notification bell. Thank you for watching, and we will see you next time.